Okay, so again, thank you for coming tonight to our webinar called Transition from Early Intervention. I've invited Chris Ching and Rebecca Butts Houghton to help me present information. And I am Christine Griffin, and I'm with Washington Hands and Voices. Tonight, we'll be taking turns sharing some information with you. So let's get started. Oops, there we go. Before sharing information, we also wanted to acknowledge that, that we are present on the land of the Coast Salish people who have sacrificed, their ancestors have sacrificed many things for us to be able to stand here with you tonight or sit here with you tonight. We want to acknowledge the peoples who are still present and who are thriving in contemporary times. We come to you tonight from Whatcom County, which is part of the Lummi and the Nooksack tribe nations, and then in the Portland, Vancouver area are the Cladamus and Cowlicks and Confederated Tribes of Grand Ronde, and in Seattle, the First People of Seattle. Tonight's agenda, we have a lot to share with you. I know this just looks like a tiny little list. We're going to be talking the difference between family-centered and child-centered services and sort of how that looks. And then a lot of different considerations for special education eligibility. That seems to be something that families are very interested in learning more about. And then we'll be sharing lots of resources and next steps to help you get along on your journey. So first, we want to introduce ourselves. So I am Christine Griffin, and like I shared, I am with Washington Hands and Voices. I'm the Guide by Your Side program coordinator with and so I support families, and I also have a master's degree in adult learning with my focus on families of children who have disabilities. The picture up top is my family. Our two children are both deaf and hard of hearing, and our son was identified when he was 5 years old. And then 6 months later, our daughter was identified when she was 2 years old. We went through early intervention with our daughter, thankfully, and that really did change the trajectory of our entire lives. And I remember transition well, but it was literally just a blip in the whole, journey that we've been on since then. I have sharpened my skills by, working with my own children and then working with other families as well. Fast forward, our kids are doing well. You can see they're young adults now. Our son and our daughter, Beth, both went on to higher education. They work and live independently as well. Chris, go ahead and introduce yourself.
Hi, everyone. I'm Chris Ching, and I'm the Director of Outreach for Birth to 5 for the Center for Deaf and Hard of Hearing Youth, or CDHY. Before I became Outreach Director, I was a teacher of the deaf doing home visits in the San Francisco Bay Area for a private early childhood deaf hard of hearing program in Berkeley. I did that for about 7 years before moving up to Portland. CDHY is a state agency, and therefore we work with other state agencies, mostly the Department of Health, the Newborn Hearing Screening Program called EDDI, which is the Early Hearing Detection, Diagnosis, and Intervention Program, and the Department of Youth, Children, and Families, the Part C program, or Early Intervention Services, and other programs and agencies. And really our goal is to make sure that parents get important information to make really well-informed decisions for your child as your child's moving through the education process, regardless of where you live in Washington. I'm going to be looking at my notes a little bit here. I just want to make sure that I'm covering everything on the slide. So if you see me looking down, I'm just taking a peek at my notes. In the picture, I'm here with my mom and dad. I'm up in the front on the right, and then my husband's on the left with his mom, and his mom lives with us. And I'm a foodie, so I included a picture of us at a restaurant. I'm going to pass it over to Rebecca. Rebecca is actually going to be taking on my position in the fall. Speaking of family, I am leaving my position to spend more time and focus on my own family. Go for it, Becky.
Thank you, Chris. Hi, I'm Rebecca, or Becky Butz-Houghton. Pause so the interpreters can switch. Okay. And as Chris just said, I'm moving into the role of Director of Birth to 5 services at CDHY. I've been with the agency for about 10 years. The last 5 years, I've been a full-time school psychologist for CDHY. And prior to that, I contracted as a school psychologist while I worked a few years in Highline School District, and then I worked a few years in Tacoma School District. Prior to my 10 years with CDHY, actually I'm from Philadelphia. So I was at the Pennsylvania School for the Deaf for about 11 years. I was an aide and then a one-on-one, and I taught middle school for a year, and then I taught preschool and early intervention for a couple of years while I was in grad school, and then moved into school psych and was a school psychologist there. Also, another hat that I've been wearing many hats lately, and now I'm excited to sort of hone in on this one hat, very big hat to wear for CDHY. I also, though, the last 10 years have been the education consultant for the hearing loss clinic at Seattle Children's Hospital. So in that role, I've been really enjoying working with families and doing advocacy work and providing resources and connecting families to resources and things they might need. So all those years together have kind of built up to this time to move into focusing on Birth to 5 and CDHY. And like Chris said, we serve the entire state of Washington. And I'm really looking forward to the next path of working in this area.
Great. All right, so we'll move on. Let's see here. Okay, so what is transition? Transition has a lot of different definitions, but what I wanted to just kind of put us into context a little bit and where families may be. So initially, as a family, you've learned about your child's hearing status, and what that means to your family and how it applies to your child's well-being. You've had to make a lot of well-informed decisions in a quick period of time. And hopefully along the way, you've enjoyed being, a parent or, working with other families. It's a lot. And so this really is no small feat to jump from all of this information into another realm, which we'll talk about in a little bit. But as adults, we build on our learning. So if you are a parent just starting out these first couple of years, there's a lot to build. We might not have any prior knowledge of connecting with a deaf or hard of hearing individual, much less being a parent of a child who's deaf or hard of hearing. And so sometimes that new knowledge can actually be kind of painful. We can feel very varied emotions and feelings all at the same time. And that is completely and utterly normal or typical. And so when I think about learning new things, it can be difficult. And sometimes when the stakes are hard, when it's our own child, it can be ultra difficult. And so that's why we say, you know, take care of yourself while you're doing so many things. I also wanted to have us remember that that this is a process, and with anything, any process is going to get better with practice. So the other thing to remember is parent engagement is the number one factor for families, for children being successful. And so what does that mean? Parent engagement. It could mean like, you know, asking more questions, you know, of your child's educators, and reaching out to different organizations so that you are building on that information to be able to continue to make those informed decisions for your child. So this slide, I will hand it off to Chris.
Okay, this is Chris. This picture here is the flow chart of the transition process for our state. The Office of Special Education Programs, OSEP, which is under the US Department of Education, they do have IDEA, the Individuals with Disabilities Act, Part C, the birth to 3, and Part B, 3 to 21, are both under IDEA. So today, or for this webinar, we're going to be focusing on the middle section of this flow chart. So that eligibility process for special ed preschool. Right, and oh, whoops, click back. I'm right in the middle there. There are some tips that can help make the transition process a little bit smoother. Participating in your meetings by talking about what you want for your child, taking notes at the meeting, or maybe inviting a friend to be a note taker at the meeting. Explore different resources and services and bring that list to share with the other professionals, with the school professionals sitting around the table or on the Zoom screen. Keep a notebook of your child's activities and interests, including maybe a copy of your child's birth certificate, immunization records, medical reports, photographs, evaluations and assessments, and the past IFSPs. I've also seen families bring pictures of their kids to help personalize these facts and information that you'll be sharing with the team. It's important to remember that although you as the parent are sitting at the table, or again on the Zoom screen with a variety of professionals, you know your child the best. You know what your child's needs are. So you are a critical team member as you move through this process. You also can benefit from support as well as your child, and that can help make that process a little bit smoother. And at the end of this webinar, we do have a list of resources that you can access, that you can get support as a parent. Okay, next slide. This is part of a side-by-side comparison of that Part C and Part B under IDEA. The biggest differences are Part C is very child and family focused. Strengths, looking at the family and the child's strengths and needs. Part B shifts over, the language starts shifting from child to student. It is more of a needs system. Sometimes you might hear a deficit model. We're really looking at the needs of the child. I'm going to look at my notes for just a second here, see if there's anything I'm forgetting. I think that's it. Next slide. This is a nice visual of the special education process. So where we're going to start is at that top part, identifying the needs. And then moving on to we use assessments and evaluations to determine those needs. Based on those needs, that is how the evaluation team or the school district determines eligibility for special education. It is completely natural for parents and sometimes for school team members to want to jump ahead and think about the placement or a location of where your child would be attending school. But it is important to follow this process. School districts usually will pull people back a little bit. Like, I know that we want to start talking about the preschool placement, but they will bring it back. We've got to follow this process. There are some different placement options. For tonight, we're really focusing on the public school system. There are also community and private-based programs, homeschooling, and then, like I just mentioned, public schools. Again, looking at notes. Just remember that you're a part of the team. Here's another visual of the special education services. The eligibility is really based on 3 different criteria. We call it the 3-legged stool sometimes. Your child must have a disability or disabilities. The disability has an adverse impact on your child's ability to learn in a general education setting. And then because of that, the team would develop specially designed instruction, or SDI, and that's part of that special education programming. Next slide. Okay, and Becky's going to talk about assessment and evaluation.
Thank you, Chris. My turn. I realized I didn't comment on my family photo like everyone else did. I forgot to do that. So I just wanted to share that photo you saw was me and my wife and our daughter, who is 5.5, and we're in the Seattle area. I just wanted to get my little personal tidbit in there as well. And I also wanted to, again, speak to the fact that this is very process and system heavy, and we're giving you lots of information intentionally because this will come at you, and our hope is that we present it now and we can kind of share it and walk through it with you a little bit. And please, your questions will come up, and keep us in your back pocket as resources, because it can be daunting and it can be overwhelming, and we're really hoping that we're intentionally giving you a lot of volume of information, because it's going to come that way pretty much. So my piece, I'm going to move into the area of assessment and evaluation. As we talked about, you've got a picture of what the system is, and really the pivot of moving into the school services is this need to be evaluated into what they consider qualify or be eligible for services. Okay, so again, here we're just going to highlight the IDEA. Chris had mentioned it's the Individual with Disabilities Education Act. So this is the federal law that is overseeing age 3 to 21 in terms of educational services. And really, it's just pointing out that the child needs to be fully evaluated. And also, I'm going to glance to the side too, because I have notes side by side on my other screen. So just to name where my eyes are going as well. So I don't miss anything, but the requirement is that a variety of assessment tools are used. So it's really important that whoever is giving the evaluation is giving a full varied evaluation that is looking at all areas of functional skills, looking at development, background, history, looking at the students' academic, or we call them pre-academic skills at this age when you're just starting to show those pre-literacy skills, and also taking information from parents. And often all this information is gathered in standardized ways, so standardized questionnaires and behavior checklists and those types of things. And to mention in here the code CFR, you'll see that throughout, that refers to the Code of Federal Regulation. So this is the federal law, and then each state kind of puts, this is the baseline that they have to meet, but then they put on their own sort of state by state spin on it and interpretation of it. So the CFRs are the federal level, and then the WACs are what we talk about a lot in schools. You'll hear that talked about a lot in schools. It's the Washington Administrative Code. So that's just the Washington state's interpretation of the federal law. Okay. So assessments, things to consider. Assessments are the tools that are being used to literally assess your child's skill level. So they want to assess where they're at, and then it's going to allow teams to look at how they monitor progress going from kind of a baseline. They're going to collect a variety of information, interviews with you, observations, testing, kind of as we mentioned, parents, teachers, specialists who work with your family or your child outside of the school program, or specialists that have been part of your early intervention experience, and the child themselves. These are all, everyone is a member of the team and it has input on the assessment and the overall evaluation. So assessments are the tools. And then, next slide. The evaluation, this is in school language, this is the process and the procedure that is used to determine qualification for eligibility of special education services. So you might hear it called a child find eval. So when you're leaving early intervention, the first evaluation, the initial evaluation that your child has is typically what's called a child find, which means that a child who's between the ages of 3 and 5, and the district is responsible to evaluate and provide support if needed. So a lot of challenges that arise in terms of the evaluation. Often schools might only look at one area and may have a vision of one specific function or deficit in one specific area to determine eligibility. Evaluations provided by parents, like you've had outside evaluations, outside testing, any kind of outside assessment, they're considered. The team is always expected to consider it by law. They have to look at it, but they don't have to take that data and make their decision based on that data. They always want to collect their own data from their own testing. And also the person who's interpreting the results, so it's often, well, we're going to name all the possible players of your team, but whoever's interpreting those results, whichever specialist it is, they may not understand kind of the unique nature of deaf and hard of hearing students' needs and what arises when we're looking at these skills that are standardized based on hearing children and how to interpret that for our deaf and hard of hearing children. In that vein of the person may not have the skills, this quote here is directly out of a position paper that comes from the National Association of School Psychologists. So those of us that are school psych, this is the national organization that certifies us. They have written a position paper regarding specifically evaluations of students who are deaf and hard of hearing, and it says that it is strongly recommended, as they word it here, that you have a deep background and be able to provide services for students who are deaf and hard of hearing. And as Chris said, we'll share our, we'll share our resources at the end. You'll receive links to all these documents. Excuse me, they're just got really dry. At the end, so you can, it's a few pages long, the paper, but really it is designed for school psychologists to read this and understand I need to seek out other sources and other professionals who have a deeper understanding of this. I should not be conducting this evaluation on my own without the background knowledge. Next. And in that, some of the things that they might need to consider Number one, that assessment tool standardized tests are typically not normed on deaf and hard of hearing children. There are a handful of assessments that are very old, and the sample of students that they use to come up with the standardized scores is a pretty low number because they're really small groups of kids that they've worked with. So we always say, view these results with caution or take into consideration hearing loss when viewing. There's lots of different key phrases that we like to put in there to just say, yes, we're going to give you some numbers because the special education system wants to have that standardized testing and wants to see numbers about performance and measuring, like Chris had mentioned, that deficit. You know, it's a failure-based model. So how low are you, which is a whole different way of looking. It's not how we want to identify our students, but it's how we get access to the system, unfortunately. A big thing that comes up during assessments is potential communication barriers. Can the child understand who's testing them? Do they have their equipment if they use cochlear implant or hearing aids or an FMDM? Whatever equipment they might be needing to use, is it properly functioning? What's the acoustics of the room that they're in? Right now, this past year, obviously, are people masked? And what material is the mask? Because depending on what the mask is, it can muffle sound. You know, plastic, although the clear ones give you visual, it muffles more sound, so less sound is getting to the child's ears. So just thinking about all those pieces of communication. And then also, are the folks doing the assessment specialists in the area of deaf education? And again, just to reiterate that, you know, we're using standardized scores. They're going to, sometimes they give age equivalents or grade equivalents, and these numbers that show, well, this is what the child did and didn't do, can kind of mask the abilities of our students who are deaf and hard of hearing, because the test doesn't always measure it in a way that they can access or they can show what they know. And another big piece to really take into consideration when we're looking at evaluating need around access to school services is what impacted the hearing loss has on social functioning, so social skills, conversation, that type of thing. Students who have any kind of hearing difference often struggle with developing all the same appropriate social skills as their peers for many reasons. They've not had a chance to practice. They may not be hearing everything that's happening around them, so they're making assumptions or misunderstanding what's being asked of them. So there's a lot of barriers in how they communicate with peers. Many students, when interviewed from young age through high school or even beyond school, have reflected and reported that they feel isolated. It's harder to have friends, or they feel like they have less friends, and they just feel unhappy in school, particularly when they don't have a chance to socialize with other kids like them. So if they're in a place where they're the only child who's deaf or hard of hearing, and maybe they use sign language or they use equipment that's visually noticed and they're being asked about, lots of things that if they're different and the only one, or they haven't met anyone else who kind of has a similar experience, it is very isolating. Something that I have heard a lot of deaf adult friends talk about was very challenging when they were younger, was when they miss something and they ask, particularly around the table, the dinner table at family parties or big gatherings, they ask for clarification and they're told, oh, I'll tell you later. Oh, it's nothing. And there's this limit that's put on them, not by choice, but other folks are deciding what information they get access to. And that just feels really, really unfair, really inequitable. And another area we look at social functioning in school, and I want to think about when we're in the evaluation process, is how are things going for your child when they're in the lunchroom or at recess or in these bigger group settings, when there's joking happening and teasing and pop culture references and lots of conversations maybe happening at the same time. If they're not able to track or follow, then there's this awkwardness to social interactions at that place too. So there's so many different layers of how we communicate and how we socialize, that we want to be able to tune into that and see, well, this is an area where they struggle, or this is an environment that they struggle, and they do qualify and show a need for some additional support, perhaps. I'm just gonna take a quick sip of water. The tickles won't go away. Excuse me, thank you. Okay, next slide. So the next couple of slides are just a really boring, dry list. but we did it intentionally. All of this is with a very great intention. These are all possible areas to consider. You certainly won't have likely you won't have every single area in your child's evaluation. However, they're all possible areas that need to be touched on. And most school psychologists, I would say, they kind of do an overview of all of these, and many of these, not all of these in some ways, but there's areas that we really like to point out, like the listening skills, not just speech and language, not just your speech production, not just your receptive language, but really your listening skills. And there are ways that professionals who know hearing loss can really dig into that and assess that. Language and communication, including American Sign Language. That doesn't mean only, whatever the child's language or modality of language is, spoken language, listening skills, but also if they're using sign language, how is that being assessed? How is that being measured? And academics and cognition are very common areas. They always have to have those. Social and emotional may or may not be assessed, but at a young age particularly, we often, I say this from my own experience, we will do some social emotional assessment, but it's very directly connected with communication. So I would work closely with the speech and language pathologist to put our results together and talk together. Maybe the student would qualify for the area of communication, and let's build in some social emotional skills into that. It's not always a separate area on an IEP or in their services. And self-advocacy is another area that sometimes falls under communication or might fall under behavior and social emotional. A lot of areas that are being evaluated that overlap and connect. So we want to make sure they're digging deep into each realm of who your child is and what they might need, and make sure we're being creative and seeing them in all different environments and knowing what we're going to address. I think I kind of touched on motor and sensory. That's, maybe there's occupational therapists or physical therapists, there's needs from them. Obviously audiology, you'll have an audiogram from a private audiologist or someone at the hospital, someone in your doctor's office, but then a lot of districts have an educational audiologist, or if they don't, there are resources to support them. One of those resources is in the room, so we can ask her to share who she is later. And then just around technology, making sure that school teams might not understand, or the evaluation team might not understand the technology. And that's something that as a family, you clearly have been well versed in and need to share with this team what your child needs in order to access these evaluations. Okay, and then the next list, even longer list. All the people who could be on your eval team. Again, you won't have all of these people, but really who's on the team? As you think about your 0 to 3 experience, it's the family, it's family members, it's providers and specialists. And then you transition to school and suddenly you have all these specialists that the school district might offer, or specialists that that you want to bring in. Remembering, again, reiterating that you are a member of the team, just like everybody else. Everyone has a seat, the same size seat at the table, and you have the right to bring anybody you want to join the conversation, to join the evaluation, to join your meetings as you go along when you talk about the results or you talk about a plan. We mentioned school psychologist is typically the person who leads the evaluation or coordinates it. A school nurse is almost always there and will ask you for developmental history and birth and early childhood and milestones. Lots of things that you have talked about. You're gonna get really well versed about telling your child's story if you haven't already. You get to retell it, and for school evaluations. We mentioned teacher of the deaf, and not every district has one. In fact, many districts do not. There are a few districts around the state that have a deaf and hard of hearing program. So they have a specific program that supports children who are deaf and hard of hearing, and they have staff who are specialized in that. Some districts don't have that program, but they have what we call an ITOD, an itinerant teacher of the deaf. So they're someone who's a trained teacher of the deaf, and they travel around the district to provide support for the children who are identified as needing special education support with them. And sometimes I was going to go down a different path, so I stopped myself. What I just want to say, I guess, is it's good to know that, because when you get to the point of the school evaluation, it's important to ask if your district has somebody, and if they don't, there are other resources that you could ask to bring in. Speech language pathologists are always in the district. A special education teacher will come in later. If your child has other tools that they use for communication, they may have an iPad, or they may have PEX systems, they may have other visual or technology tools that they use. And districts always have what we call an AAC specialist, augmentative alternative communication. So that specialist could be part of the team. Districts have social workers if that's something that's needed. Districts often have an audiologist who can be part of it. If they don't, we have ways to offer support around the state. There are resources for that. Most districts do not have an ASL specialist. However, CDHY, we do have one that can be part of an evaluation if the district and or family invites us in. We need to make sure that they're interpreters if the child uses sign, or anyone in the family uses sign, to have an ASL interpreter. If the family obviously speaks a different language, ensure that every interaction, the evaluation included, even if the parent's not being directly communicated with, the evaluation that's happening with their child is interpreted so they can follow along. And then also Hands and Voices has the Guide by Your Side program, and there's advocates that can be with you at every step of the way, that can attend events with you, and can also be another set of ears to understand the information, someone to consult and talk to you about their own experience. So knowing that you can bring in your own advocates and your own supports. Behavior specialist is often someone in the district. I'll pause for interpreters. And then also, if a student is deaf blind, there are other specialists. So most districts have a teacher of the visually impaired, a TVI. If they do not have one, they likely have a resource of someone they contract with. There's also a state resource for that. So that's important to know if your district doesn't have one. They're still responsible to include that. And then also Washington State has a program called the Washington Sensory Disabilities Services Deaf Blind Project, which we can give you more information about that. And districts also may or may not have their own, what we call O&M specialist, orientation and mobility. Again, that goes along with someone who has any kind of low vision. If the district does not have their own, which some don't, then finding out who the one is in the region that they utilize. So this just goes to show like the complexity of who might be involved, who you want to advocate for or invite into your evaluation process.
Okay, the next few slides are, excuse me, have some helpful information as you're moving through the transition process and you're working with the school district transition team. It's helpful to be aware of what things children who are deaf and hard of hearing have the right to access within their education. Some of these things, the next several slides are going to include IDEA's special factors for deaf and hard of hearing students, communication and the family's right to make informed decision on their child's and family's communication, an explanation of incidental learning and why that is so important in the development of our children who are deaf and hard of hearing, and finally, the expanded core curriculum for deaf and hard of hearing students. Next slide. I'm reminding myself before we move on, I want to put in the chat box a website that I don't think is on the resource page called Parent Hub. And it goes through all of the special factors in IDEA for deaf and hard of hearing students. These are language and communication needs, opportunities for direct communication with peers and professionals, making sure that your child has access to being able to communicate with their fellow students and peers and the school staff, academic needs and academic level, the full range of needs that might be, that a student might have. Again, opportunities for direct instruction, this direct communication with their teacher and other school staff in the child's communication modality or language, and assistive and communicative devices and services. And before we move on, I cut it and let's see if it will paste. Here we go. Okay, so here's that website I was mentioning. Also on the Washington Hands and Voices website, there are a series of short videos that explain each of these areas more in depth. We won't do that in the essence of time tonight. Next slide. Okay, so through this process of a parent making these decisions, you have the right to choose the communication method your child's language and for their communication development. We want to make sure that your child's making 1 year's progress in 1 year's time. So it's important to have ongoing monitoring, not only of language development, but other developmental skills. And again, that direct access to communication with peers and with school staff. I forgot to mention that I'm also on the board of our Washington Hands and Voices chapter. And one of the motto of Hands and Voices I really like, and it resonates with this slide a lot. What works for your child is what makes the choice right. And that's a lot about communication modality and other pieces. When Christine and Becky and I were preparing for this presentation, Christine was talking about LRE, the least restrictive environment, which also is language-rich environment. So you want to make sure that your child has both. Next slide. Christine found this great visual for incidental learning. I'm going to read a paragraph just to describe what incidental learning is. It might be defined as what a person learns through informal communicative interactions with others in public and educational and other settings. For children who can hear, incidental learning constitutes a major portion of their social development and world knowledge. However, for a child who's deaf or hard of hearing, even though surrounded by this type of learning, it's often not accessible. And that's what this picture is showing. So I'm envisioning a preschool classroom. At the center of this picture, let's say the teacher is talking about a craft project that is including apples and some paint, and the teacher is talking. As we move out to the next circle, the light blue, there might be some students who are on another side of a partition or on the other side of a bookshelf or something, doing something else, but they can overhear the teacher talking about the apples and what they're going to be doing in this craft project. The little person who is off to the left in their own little bubble, this could be a child who is hard of hearing. So although they are in close proximity, they are not able to hear completely what the teacher is talking about, that incidental access. And then the little person on the outside, on the right, lower right, might be a student who's deaf, who they're not overhearing the conversation at all. There's a story I was telling Becky about. I went and observed a preschool classroom a few years ago, and even as insignificant as a paper cut, so the kids were having breakfast and there were several tables lined up, and the little girl I was there to observe is hard of hearing. She was facing the window, and so there's several tables behind her, and one of the teacher assistants who is passing out the little breakfast packages, a student asked her to open up the French toast package, and she was like, ow! And the student, looked like, what happened? And she said, ooh, it got in my paper cut. And the student had a kind of a blank look on his face. And she said, "Do you know what a paper cut is?" "No, I don't." And so she talked about how she was opening up a manila envelope, pulling something out. And when she was opening it, the paper sliced her finger, and that is called a paper cut. The little girl, I was there, not facing the conversation, did not overhear any of that. So even that's part of that world knowledge. And these types of conversations happen all the time, not just in the classroom, but on the school bus, in the lunchroom, in the hallways. So it's something to really keep on your radar that is a critical part of social skill development, cognitive skills, and self-esteem too. Let me see if there's anything else. Oh, yes. The incidental learning over time as a child gets older informs how we learn to negotiate. Way down the road, college and career planning, health literacy, how to take care of ourselves, leadership, local and global issues, problem solving, relationships, and social maturity. So it is a very important area to consider. Next slide, please. Students who are deaf or hard of hearing have specialized needs that aren't really covered in general education. And as you can see on this list, these are some of the areas that are included in the expanded core curriculum. The expanded core curriculum does start in kindergarten, but it is important for parents to have it in your toolbox and on your radar. I'm going to read another paragraph here. Being deaf or hard of hearing can add a dimension to learning that often requires explicit teaching, such as information gained through incidental learning. It's been estimated that for people with who are hearing, 80% of the information is acquired incidentally. No effort is really required. Excuse me. Any type of hearing loss interrupts this automatic path to gain information. The incidental information must be delivered directly to students who are deaf and hard of hearing, and most teachers without specialized training do not really have expertise to address these different areas. And that's why it's important to I guess the incidental learning, but it's important to have these different areas to be aware of them as you're moving through that transition process. Okay, next slide.
Yes, this is Christine. I just wanted to also add, as a parent, this particular resource has a grid, and in each one of these categories are different areas. And so for a family to kind of not know what it is, we're asking or that we want for our children, just looking at these areas and from emergent to mastered, there's kind of a spectrum of skill progress. It gives parents an idea of what is acceptable to ask for within your child's educational team.
This is Chris. Thanks for saying that, Christine. This emphasizes why it is so important to have professionals on the evaluation team who are experts in the field of deaf education and have that background of working with kids who are deaf and hard of hearing, because the things on this list here are not included in general education. They're not included in general special education. So it really hones in on some very specific areas that you as a parent and your child's advocate can bring to the table. Okay, now next slide.
Okay, so put on the brakes. What? Not eligible? Now what? So we'll talk about what are some things that you as a family or someone who's supporting a family can suggest. So the first thing is to just keep going. Oftentimes, families aren't used to, from the get-go, advocating so hard. We want to believe and follow the lead of professionals, and that's part of being a team. But for families, there are hoops to jump through, over, and so just keep going, keep asking questions. um, One of the things that, as a parent myself, our school would hand us procedural safeguards. I don't know that it was called parent rights then. It was procedural safeguards, which meant nothing to me. And so I'm like, okay. And I never opened it. It wasn't until I began working with other families and guiding them that these things became very important. So, being able to understand what those are from the beginning is really helpful. And there is a bit of a process. So if a family is told that their child is not eligible for special education services within their school district, there are a couple of things that families can ask for. So the first item is the independent educational evaluation, and sometimes we call it the IEE. And there are some things that, once a family requests that, one, the request has to be made in writing, and then the school district has up to 15 working days to respond on whether they will grant that request at, and then the school district will pay for that evaluation. The other part is that the school districts can, file due process. I personally have not seen that, and so hopefully that's not an issue when a family does request an independent educational evaluation. Another type of support is mediation. And so if a family and a school district are at odds and um, might need help better communicating, then the family can request mediation. And so a mediator is called in and talks with the family and the school district, and then they're brought together in a joint meeting to try to come to a consensus on, what next step to take. And then due process, which doesn't make any sense to me, but it's basically suing the school district. And so that involves lawyers. Most often it's at the family's expense. There are some situations where the person who's working with the family, the lawyer, might change how that payment is done, but it is a long drawn out process. So that is something that we as organization at Washing Hands and Voices don't have the skill to be able to support a family through. And so then we, suggest that families also contact Scott Robb. He is a parent liaison at OSPI, which is Office of Superintendent of Public Instruction. So I'm watching the interpreter make sure that was a mouthful. So Scott Robb is someone who can help explain things from, a state agency to help families understand. And when a family reaches out to Scott Robb, it's also a sign that something's not quite right. So we encourage families to contact Scott Robb. He reports out to OSPI on a regular basis. So and he's very helpful. I've seen him present, and he's lovely. So anyway, I would also suggest to families to write down everything. So if you are connecting with your local school district on the eligibility process, then send emails and save those emails. That's in writing. You can also have a notebook and write down contacted this person on this date. So the rule is that if it didn't get written down, it didn't happen. So if you were having a conversation with anyone and it didn't get written down, it's likely that it won't go anywhere. They can promise you all kinds of things, but if it didn't get written down, it's not going to happen. So always in email, in writing. So we could talk more about what all those things mean too. It's also important, again, like Chris said, to track our kids' development, to be able to draw on experiences that we see our children doing at home, because those individual, evaluators aren't in our home. And so we can bring a more rounded picture of who our kids are to the table when we're meeting with them. And so it's good to be able to share those stories, and any stories. We'll talk a little bit about the parent input form after a while. And again, as Chris said, it's good to remember that a child who is typically developing can make 1 year's growth in 1 year's time. So this is just more motivation to keep going. As a reminder, even though our children, are deaf and hard of hearing is considered low incidence, meaning there's not a lot of people who are deaf or hard of hearing, it doesn't mean that it's low impact. In fact, it's very high impact. As Rebecca pointed out, there are many people that evaluate our kids, and they are on our team for a reason, because every person counts for our children. And so even though most of our kids are deaf or hard of hearing, the prevalence is that there's more hard of hearing or children who have unilateral hearing loss than there are children who have severe or profound hearing loss. And so we need to be reminding of those professionals that even though our child has a mild or unilateral hearing loss, it is important as much as someone with a profound hearing level. And so
I'm sorry, could you say that last part? I'm not sure I understood it clearly. That very last part about the unilateral hearing loss and how it affects.
Gosh, I don't know what I was saying. So even though oh gosh, so
Sorry,
even
it was about like if a child has unilateral hearing loss compared to a child who is profoundly deaf, and how the impact on that.
Right. So I guess even though a child has a moderate hearing level or a unilateral hearing loss, the impact is equivalent to a child who is deaf or hard of hearing. One of the reasons is because a lot of these kids fall through the cracks. For our kids, they had mild to moderate hearing levels, and so they were considered hearing in some respects, and then weren't necessarily, given those same services that someone who had a greater hearing level or hearing loss. So So mild to moderate hearing loss can be deemed invisible. And it doesn't mean that they hear normally. It does not mean that there's no educational impact. As we saw in the figure about incidental learning, it has a big impact. And so when we're at the table talking to the evaluating team, that this is an important point to make, that normal appearance, is a bigger challenge in some respect.
Christine,
Yes, Chris.
I'm going to just jump in because I'm thinking of all these things. We do talk about how kids who are hard of hearing can really fly under the radar a lot, because they are hearing a lot of what's going on. But there's a lot that they're not really hearing either. They can follow what their peers are doing. We will sometimes go into, now my area is birth to 5, so I'm looking at preschool programs, but general special education teachers, and this is not any kind of criticism necessarily, but just, again, making sure that you have educated observers of your child to see what they might be missing in the classroom. How can the acoustics be adjusted? How could seating be adjusted? To not make assumptions that because a student has relatively clear speech that their hearing levels, that they're hearing everything that's going on. There's a lot of assumptions that are made, and we talk about how some school staff will say, oh, they're doing just fine. And on the surface they are, but we do know that they need some other supports to help them thrive in the classroom. Thanks, Christine.
Yeah, thank you, Chris. So here are some resources that parents can reach out to. As I've mentioned, Washington Hands and Voices has the Guide by Your Side program. We do have parent guides through that program that can support and inform. Sometimes we also attend meetings. It's easier now with Zoom that we can attend more meetings and support more families. So that's been helpful to families. And then the Center for Deaf and Hard of Hearing Youth that both Rebecca and Chris work at are a great resource to touch connect with. Then we have the Parent Information Center, which is called PAVE, or Partnership for Action, Voices for Empowerment. And they have a good website. From what I haven't reached out to them in a long time, but I think that there is an online thing, something online that you can fill out and request support. And then if you're, in different parts of the state, Parent to Parent or the Parent Coalition, sometimes these programs are under, within the ARC organization in your local community or neighboring community, and they're helpful. And then we have Open Doors for Multicultural Families, and I believe they serve families in King County. I'm not quite sure if they serve families outside of King County, so that's why I put King County. Okay. Tonight's webinar, we've used a variety of different resources. These are 3 really important resources that I would have in my own, and I do have in my own resource library. There's the Educational Advocacy book for students who are deaf and hard of hearing, and that's through the Hands and Voices organization. in Washington, we are a chapter, Washington State Hands and Voices. So we are a chapter of Hands and Voices. And this link underneath will send you to their website where you can order that book. I believe it's $39.90. That includes tax and everything. These other two resources, optimizing outcomes for students who are deaf or hard of hearing, and the expanded core curriculum, are both in a PDF form. What I've done is I've put it on a thumb drive and taken it to a copy store and copied it in black and white. And because I guess I'm old school, I'm on the computer a lot. So it's just nice to thumb through a few pages. And both of these are, just resource. So you don't want to necessarily read from front to back, that they're there and they can support you throughout your child's journey. So as I mentioned a little earlier, when our kids were younger, I started using what I called the parent input form. I had gone to a workshop myself. Someone handed me, a little piece of paper, and then I expanded it once I realized, oh, there's the special factors. So I added the special factors to the parent input form. So one, it's super comprehensive. Sometimes it's even difficult to fill out because it is so comprehensive. And that's where I've helped families fill that out. You can print it off or use your computer with it. The interpreter's pause. Okay. So one of the benefits of doing this is as I worked on this every year, I then could see what I was wanting our school district to work on with our daughter. And then I could see the following year, like, oh, that was still a concern of mine last year. So it helped me advocate even stronger. Like, oh, here it is in writing, again, writing. How can we work on this? And then as our kids grew, they also helped me fill this out. So at the very top, it talks about my child most likes, my child dislikes. And so one time I think my daughter said, I don't like snow, which is true. She didn't like snow or sand. And she was very proud about putting that on the list and talking about that at her meeting. And that helped our kids advocate for themselves. Just recently, a quick story, we got to see our daughter last weekend, and she had kind of, as a teenager, our kids kind of roll their eyes at advocating because we all want to look the same and at a certain age. And finally she said, I guess I'll advocate for myself. What else do I have to lose? And I thought, yes, she's arrived. It's only taken 21 years. But anyway, so that's why when we talk about self-advocacy, for example, that's why you start early, because you want to make it a routine, not something that we just plop in middle school, because it doesn't have a lasting, as much of a lasting impression as just doing it all the time. We are updating our website. And so right now, this isn't on our website. If you want a copy of this, I'm happy to share a copy or share more explanation of it at a later date. So here are the resources that we have shared with you tonight. They are not in alphabetical order. They are in the order of the slides. So if you're someone that said, oh, this doesn't make sense, it's in the order of our slide deck. So just to let you know. And here's how you can connect with us And we hope that you'll reach out if you have questions. Right now, we will stop the recording and we'll open up to questions. So we've